Hello everyone, welcome to Health with Priskilla. On today's video, we'll be talking about oral health. Oral health is important because it gives you the ability to speak and the ability to eat. You can choose to spend a few minutes a day brushing your teeth or thousands of dollars a year repairing cavities. So today, we have a special guest to tell us all that we need to know to take better care of our teeth. Dr. Khella, welcome to Health with Priskilla.
Priskilla, it's an honor to be with you today.
Thank you. Before we dive into the questions, Doctor, the first thing I'd like you to do is to perhaps just give us a little bit of background, introduce yourself. Who is Dr. Khella?
Sure. My name is Bassem Khella. I studied dentistry in Cairo, in Egypt. Then I got accepted in Germany to do a small internship. And after that, I'm blessed to be here in Namibia for more than 2 years now.
Oh, excellent.
Yeah. So it's been going on, but I love my job. I had passion for dentistry, and I think I'm willing here to help people more in that field as much as I can.
All right. So, Doctor, the first question is, what is the biggest problem you've seen your patients present with, and what, in your opinion, is the cause of the problem?
Well, the biggest problem that I've experienced so far is the gum infection. Usually people come complaining about their gums, bleeding in the gums, or a bad smell when they wake up, or some pain which they can't really determine where it's coming from. So, of course, among all other problems, the gum problems is one of the most common ones. The second most common, of course, are the cavities. Teeth develop cavities over time as a result of many reasons. One of the reasons is eating too much sweets or drinking soft drinks that contain high amount of sugar. So when that accumulates on our teeth, then the bacteria starts to grow inside of the tooth, if I may say it in a very simple way, and then it starts resorbing the tooth structure in a way. And that forms the cavities. So the bacteria starts getting deeper and deeper inside the teeth structure, and then the cavities form. If those cavities are not attended to, then they reach the nerve. When they reach the nerve or the pulp of the tooth, then the patient comes complaining about severe pain in their teeth, and they complain about headaches, and they complain about that they can't sleep because of the pain, they can't eat. All of these complaints are because of the cavities.
All right. So apart from brushing our teeth at least twice daily, what else can one do to prevent cavities?
The first thing is to stop eating sweets, of course, or to decrease the amount of sugar that they eat on a daily basis. The second thing is drink a lot of water, of course, and flossing is very important, especially before we sleep, especially in the evening time, because if we leave the food and then we sleep, the mouth is not moving, nothing is moving. In daily life, in the morning, like we wake up, we drink water or coffee or tea, we speak with people, we interact. So the saliva is moving, the tongue is moving, the mouth is moving all the time. So there is a motion of saliva washing the teeth naturally. But when we sleep, we don't talk, we don't speak, we don't drink anything, there's no motion. That's where the bacteria starts to grow, and that's where the bacteria starts to do its action. So it's most importantly to brush the teeth in the evenings before we sleep, and also to floss, make sure there is no food stuck, there's nothing on the teeth, especially before we sleep.
Okay, all right. Very useful advice there, Dr. Khella. So then looking at cavities, Doctor, I'd like to know what else is it that one can do apart from brushing our teeth, basically, just to keep cavities away?
Something that I really advise all my patients or anyone that I meet, if they ask me, please visit your dentist at least twice a year, every 6 months, for just a checkup. Even if you don't complain, don't wait till there's pain.
Oh.
When there is pain, it means it's a bit late. It means it's approaching the nerve. Please visit your dentist every 6 months just for a checkup. Just let him see what's wrong and just to check your teeth and tell you what's happening. Once we do that, then we can avoid lots of problems. Rather than waiting, then there's a symptom or there's pain and then reacting to it. No, we just diagnose in advance, see what's wrong, and then treat it as fast as possible and as simple as possible. We can avoid lots of problems in the future.
Last but not least, Dr. Khella, I've been dying to ask you this question. When you want to buy a toothpaste, what is the most important thing to look at? What does an effective toothpaste contain?
Thank you for this question. I'm gonna tell you a surprise now.
Alright.
Most of the toothpastes are basically the same. It's not about the toothpaste. It's about how we brush our teeth. Usually most of the toothpaste now, they contain fluoride, which is important in fighting the cavities. And you'll find many kinds of toothpaste which can deal with certain type of sensitivity. They have desensitizing agents, or there are toothpastes that say it can whiten the teeth. They have hydrogen peroxide in it. So it depends, but usually most of the toothpaste, they are basically the same. So it's never about the toothpaste, it's about how we brush our teeth. So to make it short, the thing is, to brush our teeth, we should go in a circular motion all around. Not very hard, not like this, but in a circular motion all around the teeth, very gently, and make sure that most of the surfaces are covered and we just clean most of the surfaces. In addition to that, of course, cleaning by the dentist or the oral hygienist every 6 months, because cleaning will remove all the plaque and all the bacteria around the teeth.
Okay. So any other advice that you have for the viewers?
Besides, of course, visiting the dentist twice a year, we should make sure that we keep our teeth as clean as possible throughout the day. Also, we should make sure we floss between the teeth, and also make sure that we at least do a mouthwash at least once a day, so that we can avoid any gum infections in the future. If we do those basic things, if we visit the dentist twice a year, if we brush our teeth twice or 3 times a day, if we floss, I can assure you that most of our health problems regarding the oral cavity, regarding the teeth, will be minimized in a great way.
Alright. So can you show me cavities perhaps on that mannequin?
Of course. So if you see here, those teeth, they contain cavities. So cavities start as a small pit or a small hole in the tooth, which you don't feel it at all. When you start to feel it, that means the cavity is deep. So, but when you go to the dentist and he makes a checkup and he checks your teeth, then he can find or detect early cavities that he can treat without pain. And he can warn you that they're starting to form, we can treat them now before they reach the nerve. Once they reach, it forms the infection. When the cavity becomes very deep, it reaches the nerve, it goes to the pulp of the tooth. If it's not treated, then it causes the infection down the root. At this stage, either we consider a root canal treatment or extraction and putting an implant or a bridge. It depends, of course. There's a lot of options. But if we treat the cavities as early as possible, we can avoid lots of problems in the future.
Alright. And extraction is one of the things we do not want to have.
Sometimes it's needed, but of course we try to save the tooth as much as possible. But sometimes it's too late, so we rather extract to avoid infections and then think about other restorative options.
Okay. Thank you, Dr. Khella.
It's a pleasure. Thank you for having me.
So there you have it. That was Dr. Khella on the importance of taking care of your teeth. Please share this video with your family and friends and keep flossing.